All right, back to TJ's Tuesday Tidbits, and this Tuesday we're going to be talking about shoulders. I vaguely remember discussing some shoulder issues, but I don't think we've been specific shoulder things that we're going to work on, okay? So when you look at shoulders, you're looking at impingement syndromes, you're looking at adhesive capsulitis, you're looking at, which is frozen shoulder, you're looking at AC joint or your separated shoulder, you look at labral tears. There's a condition called HAD, sprained strains. It can come from your neck, it can come from your mid-back, it can come from rib issues. I've even seen tennis elbow cause shoulder issues. Lots of different things can cause shoulder issues. So when you're looking at a shoulder, you're looking at what is the issue and why is it going on? Is it neurologic? Is it a space-occupying lesion like a Pancoast tumor? Okay? Is it just muscle imbalances? So when you come into our office, those are all the things that we look at. We really break down what's going on with your shoulder. We're looking at your rotator cuff muscles, which are your supraspinatus, infraspinatus, teres minor, your subscapularis. We get involved with the stabilizers in the back, which are your rhomboids, major and minor, your levator scapulae, your trapezius, okay? We start looking at the collarbone. Is this being compressed or separated? Right? That can all be pec involvement, okay? A lot of different areas to decipher what's going on with the shoulder, and if your practitioner isn't doing that, he's not doing you justice on what's going on. So you need to figure that out. What happens when you go to the medical doctor? They might do an MRI, they might do some x-rays, see what's going on that way, refer on to an orthopedic, see what's going on with your shoulder function. Now, it can be anatomical, so if you have a labral tear and a rotator cuff tear, sometimes those things can't be repaired without surgery. Okay, that's where you need a good practitioner to know exactly what's going on. Okay, so when you come into our office, what do we check? First thing we go through is we figure out your reflexes and we figure out your sensory, because we want to make sure that you're getting all the feeling where you need to go. And then we'll start checking into your muscle balances. Something as easy as a muscle not firing off as well as what it should can wreak all kinds of havoc into your shoulder function. And that's what we start to work on. We start balancing that shoulder out, especially in your chronic shoulder issues, okay? If you've had a shoulder issue for more than 6 months, and we'll go right into what's causing that dysfunction, and we'll start to figure out what we got to do to rehab that thing, okay? Rotator cuff exercises can be really important, but if any of those exercises cause you pain, you need to stop, okay? We don't want you to create pain, and now this is also where you get in the differences of whether or not it's sore or is it painful. Because if it's pain, you gotta quit. You could be causing more damage than good. If you have just soreness from using it and it gets better, then by all means keep doing what you're doing. Okay. So some take-home factors just to start implementing now. You can Google rotator cuff exercises. Okay, and start doing those. Those can stabilize the shoulder a lot. A lot of them involve band work. Okay, very easy to do. You do them a couple times a day, and you might create a lot of shoulder stability that way without having to go see anybody, if they don't cause a bunch of pain, okay? If that doesn't help, or you just you need to come in and see what's going on, what we would do is we'd figure out which muscle exactly is weak, or which muscles are weak, along with the function of the shoulder, and we start to rehab that. We are taught in our society we need to have strength. We need to do our push-ups, we need to do our bench presses. Everything that we're doing is in front of us. Pretty soon we go from the shoulders at our back to this rolled forward posturing. When that occurs, that's when most of the shoulder dysfunction happens. And when that shoulder dysfunction happens, we need to recreate the muscles to pull those shoulders back, because these pec muscles are super tight. And we need to decipher which muscle isn't doing its job and allowing your dysfunction to occur. Okay? So lay off the bench presses and the push-ups, work on the rotator cuff. You can even work on some back rows or some reverse flies. You can look all those up on Google just to try and get those muscles of strength in the back. Get into a practitioner, see what they say about that chronic shoulder issue. If you come into our office, we have a wonderful program, less than $100 a month. We'll rehab your shoulder entirely. If you can afford that, come see us. We'll give you a discount on coming in. We'll do a preliminary treatment protocol for you for 2 visits to see if it works. That's $150. That's like a $900 value for $150 just to see if it works. All right? If that's interested, if you find that of interest, give us a call, 507-425-0025. foldafamilycairo.com. Send us an email. We'll give you as much information as we can about your shoulder, and you feel free to ask any questions that come to mind. Once again, it's TJ's Tuesday Tidbits. We're going to be talking about sleep next week. So if you have sleep issues, tune in, all right? And we'll see you then. Thanks a lot.